The hepatitis B vaccine. It is the first vaccine many infants will receive within 24 hours of being born. Booster doses are also provided to adolescents as part of the immunization programs in schools, and it is a requirement for healthcare workers to also be vaccinated. But why? Hepatitis is a general term meaning inflammation of the liver. The condition may be temporary, acute, or can progress into chronic hepatitis if it is unresolved for over 6 months, as the liver becomes characterized by tissue scarring, cirrhosis, and enters a state of liver failure, and in some cases hepatic carcinoma. The etiology of this inflammation is used to classify the type of hepatitis, being caused by either infectious agents like viruses, bacteria, fungi, and parasites, or non-infectious causes such as alcohol, drugs and medications, autoimmune and metabolic disease. Viral hepatitis is the most common form of hepatitis, and there are 5 different causative viruses ranging from hepatitis A to E. So Steve, tell me, how are you feeling today?
The signs and symptoms of viral hepatitis vary based on what phase in the disease pathogenesis the patient is at, and some patients with cirrhosis can be asymptomatic. Symptoms patients may present with include a lack of appetite, fatigue and weakness, nausea and vomiting, and dark-coloured urine. Some clinical signs observed by healthcare practitioners can include hepatomegaly, splenomegaly, ascites, clubbing of the extremities, and hepatic encephalopathy, but primarily asterixis. Globally, there are more than 300 million people living with chronic hepatitis B or C. In 2016, there were approximately 232,000 Australians living with Hep B and 227,000 living with Hep C. On the left, we see that in 2015, 66% of the newly diagnosed hepatitis C infections were in males. And similarly, on the right, we see that in 2015, 53% of the new diagnoses for hepatitis B were in males, being consistently higher than the females. As we see on the left for Hep C and the right for Hep B, the 25 to 39 and the 25 to 29-year-old age groups had the highest rate of notification over the 10-year period, attributed to higher practicing of injecting drug use, which is the primary route of virus transmission, and typically starts in late adolescence, taking several years for the complications of cirrhosis and liver failure to manifest. In 2015, over 35% of all Hep C notifications were from outside major cities, despite them only making up 29% of the population. However, regional areas with the highest notification rates also had the lowest specialist liver treatment services available per capita. The liver is an organ located in the upper right side of the abdomen, and it performs many light-sustaining functions, including the formation of bile, which is essential for the removal of bilirubin, and aids in the digestion of dietary fats and fat-soluble vitamins. The liver also regulates glucose metabolism and maintains a homeostatic blood glucose level. It also removes ammonia, a toxic byproduct of gluconeogenesis, converting it to urea, which can be excreted by the kidneys. The life cycle of HBV is complex, acting as a stealth virus to evade the immune system. The double-stranded HBV virions bind hepatic CD8-1 cell receptors and easily enter hepatocytes, penetrating the nucleus where the DNA is converted to covalently closed circular DNA, cccDNA, which is very stable and can stay in the host for many months to years. Hepatocytes then express abnormal proteins which are presented on their surface by MHC class I molecules. The immune cells infiltrate the liver, the CD8 T cells, recognizing these abnormal proteins, leading to cytotoxic killing and apoptosis, forming Councilman bodies, which is the main mechanism behind the liver damage. The virions are then released into the bloodstream where they invade other hepatocytes and repeat this process. The 4 phases in the pathogenesis of chronic hepatitis B are 1. Immunotolerant phase, where patients are asymptomatic and viral replication occurs. 2. Immune clearance phase, where the immunotolerability is lost and the immune system attacks the infected hepatocytes, elevating ALT, alanine aminotransferase levels, which is an enzyme normally confined to the liver. The icteric phase is phase number 3, where patients may note dark urine and light-coloured stools, upper quadrant pain, and hepatomegaly. Jaundice develops as the body loses its ability to conjugate bilirubin, and unconjugated bilirubin accumulates in the bloodstream. Conjugated bilirubin, urobilinogen, is leaked from the cells into the bloodstream and is excreted by the kidneys, causing dark urine. And bile is no longer excreted in the stool, and it becomes pale. In phase 4, the reactivation phase, HBV DNA levels are undetectable in the blood. Symptoms resolve, and the liver will attempt to regenerate over the fibrotic scarred tissue. However, there is an increased risk of hepatocellular carcinoma.